Good evening, and as we come on the air for this Friday night's 11th hour, a reminder, today was day 1219 of the Trump administration, leaving 165 days to go until our presidential election. And this president's campaign toward the so-called reopening of our country, even in the face of climbing case rates in almost half of our states, faces its single biggest challenge yet this weekend. That's because millions of us are determined to do something that feels vaguely like the traditional start of the summer season. What happens this weekend, and really starting now, will be seen inextricably through the lens of the president's messaging about reopening, which we heard again today, this time with an emphasis on November.
We have to win the White House. We're going to do great with our economy. We're going to see, you already see it starting to happen. We're trying to get some governors, they're not opening up, but they'll be opening up pretty quickly.
The White House had hoped we would be further along in the effort to combat the virus and move on. You may recall this moment, the prediction the vice president made to Geraldo.
I think by Memorial Day weekend, we will largely have this coronavirus epidemic behind us.
It is not behind us. That has not happened, with over 1.6 million confirmed cases, again, that we know of in the U.S., and the death toll right now at 96,368. The New York Times reporting tonight, Trump has started questioning the death toll numbers in meetings with senior health officials, quote, suggesting the numbers which have hobbled his approval ratings and harmed his reelection prospects are inflated. They go on. There is a suspicion that data compiled by state health departments and the Centers for Disease Control and Prevention include people who have died with the coronavirus, but of other conditions. We should also note here, others have expressed the opposite view, that we have undercounted the deaths caused by the coronavirus. Also, the Washington Post reporting this alarming news that the virus may still be spreading at epidemic rates in 24 states, especially in the South and Midwest. And we quote, researchers at Imperial College London created a model that incorporates cell phone data showing that people sharply reduced their movements after stay-at-home orders were broadly imposed in March. The model, which has not been peer-reviewed, shows that in the majority of states, a second wave looms if people abandon efforts to mitigate the viral spread. The latest ABC News Ipsos survey indeed shows 39% of Americans approve of Trump's handling of the coronavirus. That's the lowest percentage for the president since they started polling this back in March. In today's briefing room appearance, Trump pressured states to allow places of worship to open immediately, even though a lot of public health officials continue to warn against group gatherings.
I'm identifying houses of worship, churches, synagogue, and mosques as essential places that provide essential services. Some governors have deemed liquor stores and abortion clinics as essential, but have left out churches and other houses of worship. It's not right. So I'm correcting this injustice. I call upon governors to allow our churches and places of worship to open right now. If there's any question, they're going to have to call me, but they're not going to be successful in that call. The governors need to do the right thing and allow these very important, essential places of faith to open right now for this weekend. If they don't do it, I will override the governors. In America, we need more prayer, not less.
Widely agreed he has no legal power to override the governor. Shortly after that, the CDC quietly released its recommendations for religious gatherings. Then Trump's press secretary was asked about his authority to demand that houses of worship reopen.
president said he's going to override the governors. Under what authority would he do that?
Well, I think you're posing a hypothetical, and I think we can all hope that we see governors.
Would override the governors.
You're posing a hypothetical, though. You're assuming that governors are going to keep churches shut down and keep mosques shut down and keep synagogues shut down. It's interesting to be in a room that desperately wants to seem to see these churches and houses of worship stay closed.
The president said that he has that.
Really, I object to that. I mean, I go to church. I'm dying to go back to church. The question that we're asking you and would like to have asked the president and Dr. BIRX is it safe?
The Washington Post brings us the facts here, reminding us, quote, commanding places of worship across the country to open is not something Trump can do. When to open public venues of all types is up to the governor of each individual state. However, just last month, Trump's attorney general set up a flare about all this, signaling his concerns about limits state officials had put on worship services and other activities in order to contain the virus.
We have to be very careful to make sure this is, that the draconian measures that are being adopted are fully justified. We've seen situations even up till now where some jurisdictions have imposed special burdens on religion. We jawboned the local governments at that point, saying they really couldn't do that, that whatever they were doing to churches, they had to do to everybody.
And indeed, tonight, our own network is reporting the Justice Department is backing a lawsuit challenging stay-at-home restrictions in Illinois and warned L.A. officials about the legality of long-term lockdown orders. That as Michigan Governor Gretchen Whitmer extends Michigan's stay-at-home order past its scheduled 28 March, now expiring June 12th, adding that theaters, gyms, casinos would remain closed. Meanwhile, a new study of 96,000 seriously ill COVID-19 patients find that those who were treated with hydroxychloroquine and chloroquine were more likely to die or develop dangerous heart rhythms. As you know, the president has promoted the drug, and he did one better. He's been taking it to ward off the coronavirus, a power the drug does not have. Dr. BIRX was asked today about the study's findings.
Can you comment on the latest study on hydroxychloroquine? The president's obviously said that he's been taking it. What's your recommendation?
It's one of our clearest studies. There are still controlled trials going on looking at, in a hospital setting, how these drugs do. And I think those are still pending.
BIRX also noted the task force is keeping an eye on virus outbreaks in the District of Columbia, Maryland, Virginia, Nebraska, Illinois, and Minnesota. We should also note the task force has been all but silent publicly. This is all happening as well as reported increases in other states, and it has heightened the focus on efforts to develop a vaccine as quickly as possible. Earlier today, Dr. Fauci talked about the U.S. development project and whether a vaccine could be created before the end of the year.
I think it is conceivable, if we don't run into things that are, as they say, unanticipated setbacks, that we could have a vaccine that we could be beginning to deploy at the end of this calendar year, December 2020, or into January 2021.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.